Hello and welcome to our presentation on pregnancy and cytomegalovirus. Congenital cytomegalovirus infection is caused by the human cytomegalovirus, which is a double-stranded DNA virus that belongs to the beta herpes virus subfamily. It is the largest and most complex of the herpes viruses. Some basic microbiology descriptors of cytomegalovirus. The cytomegalovirus is composed of 3 layers, the outer layer being a lipid bilayer envelope. Then there's a middle tegument layer, which is made of proteins that control viral entry, gene expression, and evasion of an immune response. And then there is an icosahedral capsid, which icosahedral refers to the shape. It's a 20-sided polygon. It looks like a sphere, but it's actually a polygon. And that layer encloses the double-stranded DNA genome. So a nucleocapsid is also made up of proteins, and it is designed to protect the nucleic acid genome within it. And speaking of the genome, like I've mentioned, cytomegalovirus has a linear double-stranded DNA genome with roughly 235,000 base pairs of double-stranded DNA in a single chromosome. A cytomegalovirus is about 150 to 230 nanometers wide in diameter. Different sources cite different numbers, but that's the approximate range. It has a broad tropism, meaning it can infect a broad cell range within its host, including parenchymal cells, connective tissue cells of almost every organ, and then various hematopoietic cells. So its main target for virus replication are epithelial cells, endothelial cells, fibroblasts, and smooth muscle cells. And cytomegalovirus is an obligate parasite, meaning that it cannot complete its life cycle without exploiting a suitable host.
So, talking about how cytomegalovirus affects pregnancy, we first need to understand that vertical transmission means that the virus is passed from the birthing parent to the baby in utero. As you can see from these numbers right here, that as gestation progresses, the incidence of vertical transmission increases. It's important to note that the periconception period and the conception period, although it's lower in the incidence of vertical transmission, this is when the most fetal impairments are going to happen, particularly all the way through the first trimester. And usually the impairments are more serious in nature. It's also important to notice that the incidence of infection, this is the most common congenital infection in 0.5% to 2% of all live births, as well as this virus has a seroprevalence, meaning found in the blood, of 83% of people globally. Those numbers can differ depending on what study you look at, as well as where those studies are looking at the seroprevalence particular to a certain state or country. So, taking a look at the outcomes seen in the baby from cytomegalovirus that are found through the child's development and upon birth, some are seen physically and some are more like neurodevelopmental delays, cognitive and motor impairment, microcephaly, hepatosplenomegaly, which means like basically an enlargement of the spleen and liver. This is kind of an interesting word. I had to look up how to pronounce it, but it's called putikii. This is like little spots on the baby. They can be local or it can be widespread that is actually bleeding. They can look purple or brown. Jaundice as well. This is not the normal physiological jaundice that you see between that starts developing between day to 3 to 5 after the baby's born. But this is more of like within the 24-hour of jaundice. Chorioretinitis, which is the choroid and the retina that's inflamed. And that can also lead to visual impairment, thrombocytopenia, anemia, and this is congenital anemia. And then also the biggest one that I want to focus on is hearing loss. This is the leading cause of hearing loss that is non genetic. And I will go over a little bit more about what that kind of looks like in midwifery. So, going over what that looks like in testing for hearing and screening. Um, in midwifery, we do the newborn autoacoustic emissions testing that kind of listens to the sound waves that are a feedback of the sound waves coming out of the ear. When that says refer on those results, we usually do a second testing a little bit later after maybe some of the birth fluids and stuff clear from the baby's ear. If that test says refer, then we are going to be referring our clients out for cytomegalovirus testing, as well as an ABR referral, which is the auditory brain response that measures the brain reaction to sound.
CMV is commonly associated with the salivary glands. This infection is very interesting in the way that it affects somebody's body. Normally, if you are healthy and you have no underlying conditions, you get the initial infection, you recover with no issues, but then the infection does not just go away. The virus lies dormant within the body, particularly in monocytes and other leukocytes. And in times of immune system compromise is when it will reactivate. It's estimated that approximately 59% of the population older than 6 years old have been exposed to CMV. CMV infects roughly 60 to 70% of adults in industrialized countries and around 100% in emerging countries. So, what are the symptoms of CMV? CMV, as I stated previously, tends to be asymptomatic in healthy adults who have normally functioning immune systems. But if they do have symptoms, they tend to be minor, and they tend to be things such as fatigue, fever, sore throat, and muscle aches. Now, does that sound familiar to you? That's because CMV can sometimes be misdiagnosed as mononucleosis or the flu due to the general symptoms that are felt. Interestingly enough, mono is the most prevalent presentation of CMV in those who have an intact immune system. Most people are asymptomatic when they contract CMV, but those who are immunocompromised can experience more devastating effects. And those who are immunocompromised can include infants who were infected pre or perinatally. Most babies who have congenital CMV appear normal at birth. The CDC says about 1 in 200 babies is born with congenital CMV. Some can develop complications months or even years later, such as hearing loss, vision problems, and developmental delays. Sick infants can have enlarged spleens, pneumonia, and skin rashes. They also, if they are symptomatic at birth, can have a preterm birth, low birth weight, jaundice, microcephaly, an enlarged, poorly functioning liver, and they can also experience seizures. The CDC states that about 1 in 5 babies with congenital CMV will be affected by birth defects or other long term issues. So now that you know a little bit more about CMV, you might be wondering, how is it transmitted and how can you test for it? CMV is contracted through exchange of bodily fluids. Some routes of CMV transmission include blood products such as transfusions, viral shedding and close contact, sexually through the exchange of bodily fluids such as semen or vaginal excretions, prenatally from the birthing person to the baby, and breastfeeding as well. Adults can be tested for CMV utilizing blood work, whereas for babies, urine and saliva testing can be done after birth within the first 2 to 3 weeks.
So, adults with young children, or if they work in a setting with young children, work in healthcare settings, are all people who are going to be at greater risk for CMV. Some ways to help with that prevention is obviously washing hands frequently with soap and water, especially after handling dirty diapers, so doing diaper changes, feeding babies if you're feeding with bottles, wiping their noses, or even playing with children's toys that may have come into contact with their mouth. The March of Dimes recommends to avoid kissing children's faces anywhere that's going to be near their tear ducts or near their mouth where there's additional saliva. It's recommended to not share things that come into contact with your mouth, so like toothbrushes or sharing food and drinks, drinking from the same cup or using straws, utensils. All of those things are going to put you at greater risk. And then cleaning countertops are like high traffic places often. If your partner has CMV, it's recommended to use protection when you're having intercourse to reduce your risk as well. And then CMV can be passed down to your baby through breast milk. So, March of Dimes has mentioned that if your baby is born at full term, then breastfeeding is typically okay. Anytime a baby is born prior to 30 weeks, or if they're under 3.3 pounds, there is an increased risk of them getting CMV through the breast milk. However, there's been studies to show that freezing and then reheating or pasteurizing the milk afterward can decrease that risk as well. For treatment, there is not currently a cure or a vaccine. However, there has been a vaccine in the works for some time now. Most adults who have CMV don't necessarily need treatment, but those who have like a weakened immune system may need to take antiviral medications. Babies who show signs at birth of having congenital CMV will also be treated with an antiviral to reduce their risk of developing any health issues in the future. However, babies who do not show any signs of CMV at birth, giving them a treatment is not recommended at this time. Should either way, regardless if baby is showing signs or not having signs at birth, it's recommended to have them regularly get hearing checks just to keep up on that progress. If over time they do start to show signs, then getting that treatment right away will be helpful. And listed up here are some of the antiviral medications that they would have available for them.
So these are our references. We did take the time to make sure that we were meeting the gold standard of newer journal articles that were peer reviewed, that were high quality in study with the amount of people that were studied. And as well as we did take some information in the DO Verdi study that was a little bit older, but that focused on the microbiology, which has not changed in that department, as well as there was one from the March of Dimes, but we did find this information to also be backed by peer-reviewed studies as well.